All right, so we'll go ahead and get started, and people are slowly coming in. So welcome everyone. I'm Maddie Dix. I am the alumni coordinator for the School of Nursing. And we are excited to welcome you to the fourth session of the School of Nursing Hub's research series. As you all probably know, the School of Nursing, of course, has many opportunities for research, including research programs that are aimed at advancing nursing science and practice. Within these programs, the school is home to now 6 hubs or research areas, which provide funding opportunities to foster collaborative research among faculty members and students, all who have similar research interests or are pursuing pilot projects on similar topics or themes, or integrating multiple existing projects together. So we're excited to continue these research presentations with the Cancer Survivorship Hub. So Dr. Catherine Bender is joining us today to represent this hub and show the association between disease and treatment-related symptoms and patient and provider adherence to prescribed cancer therapy. So Dr. Bender pre-recorded her presentation, so I'll be sharing my screen so we can view her her presentation on the research hub. At any point you guys have any questions, please use the chat function or the Q&A function, and Dr. Bender will be answering those questions after her presentation. So without further ado, I will share my screen and we will get started. Dr. Bender, since you are the only person that I can see / hear, I'm going to need you to be my my ears.
Okay, it
So
looks
can you
good.
see and hear?
It is my pleasure
Yes.
to
Awesome.
speak
Perfect.
to you about the Cancer Survivorship Hub of the University of Pittsburgh School of Nursing. I'm Catherine Bender. I'm a professor in the School of Nursing and the CTSI and the Nancy Glunt Hoffman Endowed Chair in Oncology Nursing. I am also co-leader of the Biobehavioral Cancer Control Program of the UPMC Hillman Cancer Center. So I'd like to begin by speaking to you about why it's so important to address the issues of cancer survivors. A cancer survivor, as defined by the American Cancer Society, is any person who has been diagnosed with cancer, and they are a cancer survivor from the time of that diagnosis through the balance of their lives. This is a definition that's consistent not only with the National Institutes of Health, but other national organizations in the United States. The number of cancer survivors in our country is increasing rapidly. As you can see, it's estimated that by the year 2040, we will have 26.1 million cancer survivors in our country. This figure illustrates for you the number of cancer survivors per cancer type. And as you can see, women with breast cancer make up the largest group of cancer survivors in our country, followed by men with prostate cancer. In addition, this figure illustrates the age groups that have the most common or the greatest number of cancer survivors. So once one reaches the age of 50 and older, this makes up the largest by far group of cancer survivors in the United States. Now, why is this so important? Well, as you know, with improvements that have been made and scientific breakthroughs in cancer treatment, as well as early identification of the problem through advanced screening technology, people with cancer are living much longer than they have even 20 years ago. But with these advances in diagnosis and treatment, We are finding that people who are cancer survivors are living longer with short and long-term effects of the disease and its treatment. These short and long-term problems impact the quality of life and the functional ability of cancer survivors. And so cancer survivorship research focuses on studying these problems, learning about the problems, what causes them, the mechanisms of those problems, as well as who is at risk for greater severity of those problems and interventions to manage those problems. And so the goal of the Cancer Survivorship Hub is to develop effective, personalized symptom management interventions to improve outcomes in cancer survivors. So these long-term problems, these short and long-term symptoms that cancer survivors experience are the focus of the work of the Cancer Survivorship Hub. And we are also conducting research, as I will illustrate to you, that is focused on identifying these symptoms, finding out who's at risk, what are the mechanisms of those symptoms, and then how can we manage them to improve outcomes in cancer survivors. Now, what are some of the outcomes that we study? Well, we do study quality of life. We study functional ability. So are cancer survivors able to maintain or return to the functional roles that they had before their cancer diagnosis within their families, in the community, and their functional roles at their occupation? We also study adherence to cancer treatment. That means the ability of patients with cancer to take that very therapy that is saving their lives. Our Cancer Survivorship Hub works to promote collaborations among our members, to support and mentor our members at all levels. So we have members who are students, both from the undergraduate level all the way through the doctoral or PhD or DNP levels in the School of Nursing. And we support the research of our investigators and members through multiple mechanisms that I will be sharing with you over the course of this presentation. So why the University of Pittsburgh School of Nursing? Why cancer survivorship here? Well, we have a very rich history of cancer survivorship research and training at our school. This was the first graduate program with a specialization in oncology nursing. That first graduate program was here at the University of Pittsburgh School of Nursing. We have outstanding faculty with expertise in cancer survivorship, both clinically as well as in terms of research, as I'm going to illustrate to you. The University of Pittsburgh is a rich environment for the conduct of clinical research. And we have a long tradition in our school of highly effective collaborations across multiple disciplines here at the University of Pittsburgh and outside of our university. We have strong linkages to the UPMC Hillman Cancer Center, and we also have an established productive relationship with the Oncology Nursing Society, which I'll speak more about in a little bit. So we are very fortunate to have the UPMC Hillman Cancer Center at our back door, located in the Shadyside neighborhood of Pittsburgh. Our investigators are all, our senior faculty members and our junior faculty members are all also members of the UPMC Hillman Cancer Center. In particular, our members are part of the biobehavioral cancer control program of that center. In addition, our members hold leadership positions at the Cancer Center. For example, Dr. Margaret Rosenzweig is, in addition to her many roles in the School of Nursing and at the university, she is Associate Director for Catchment Area Research at the Hillman Cancer Center. And I am honored to be the co-leader of the Biobehavioral Cancer Control Program of the Hillman Cancer Center. In addition, the Oncology Nursing Society is headquartered in Pittsburgh. This organization is really an international organization that is the standard bearer of oncology nursing and advanced cancer care for the world. We're so fortunate that it's headquartered in Pittsburgh, and our faculty members have held multiple leadership positions at ONS. To highlight one of our members, Dr. Laura Fenimore, who we are very proud of, she has been an active leader in the Oncology Nursing Society for many years. She's been director for 2 separate board of directors and director at large. She's been Oncology Nursing Society treasurer. And finally, she is the immediate past president of the Oncology Nursing Society. Because of her strong legacy in advocacy work, in international representation, and in guiding the future in terms of the priorities of the Oncology Nursing Society, she has been selected. She was actually nominated by the ONS and selected by the American Nursing Association to serve as its organization affiliate liaison to their board of directors. In this capacity, she will serve as commissioner on the National Commission to Address Racism in Nursing. This is quite an honor. We are very, very proud of Dr. Fenimore's wonderful work, both with this organization and now her new organization with her new work with the American Nurses Foundation. And finally, our school holds the Nancy Glunt Hoffman Endowed Chair in Oncology Nursing. Nancy Glunt Hoffman is a graduate of our School of Nursing. Unfortunately, she died of breast cancer, and in her honor, her family endowed this chair in oncology nursing. I am humbled and honored to say that I hold the Nancy Glunt Hoffman Endowed Chair in Oncology Nursing. This endowed chair is one of a very few chairs in oncology nursing in the United States. And it supports my work in not only conducting research in cancer survivorship, but also in mentoring the next generation of researchers in oncology nursing. So now what I'd like to do is share with you some of the groundbreaking research conducted by our members. I mentioned to you our work in characterizing symptoms and the mechanisms of those symptoms that is so fundamental to leading to interventions to manage symptoms and improve the lives of cancer survivorships. So first I'll talk about the work of Dr. Susan Westmiller. Her work focuses on characterizing nausea and vomiting. This is a common experience experienced by women with surgery for breast cancer, as well as with the chemotherapy that some women with breast cancer will get as treatment for their disease. So she has conducted groundbreaking work describing that symptom, particularly during the year following the diagnosis of breast cancer. And she is using unique genomic approaches to help understand this problem. This slide illustrates some of the pivotal findings of her research thus far. What she has found that is so groundbreaking and important is that almost a third of women continue to experience nausea and vomiting a year following that diagnosis of cancer. We used to think that once a woman finished her chemotherapy for breast cancer, and once she was beyond her surgery, she stopped experiencing nausea and vomiting. But her work says to us, no, nearly a third of women continue to experience this problem. She's also found that 40% of women continue to experience pain 12 months after surgery. Now, why is this important? Well, we know that one of the remedies for pain management is drugs that helps to manage that pain. But because women experience nausea and vomiting with some of the drugs they take to manage that pain, they continue to experience pain because they have expressed to Dr. Westmiller and her team that they would rather experience pain than take these pain management medications and have the nausea and vomiting that goes along with them. Finally, she's also found that women scheduled for radiation therapy experienced nausea and vomiting associated with that radiation therapy. This is a new and unexpected finding. So I think all of this illustrates the importance of her work. She also has received a COVID supplement from NIH, and this is to study the effect of the pandemic on the symptoms experienced by women with breast cancer. And what she has found thus far is that during the pandemic, women are experiencing more severe symptoms, and that these symptoms are giving women an increased feeling of hopelessness. These are some of the comments that women have expressed to Dr. Westmiller and her team. Some of these are really heartbreaking comments, such as this first one. The worst part is having to go through my first radiation treatment by myself. So I think that if you look at some of these comments, you can see that COVID has certainly enhanced, unfortunately, the symptom experience of women with breast cancer and other cancer survivors. And so it's pivotally important that we understand these problems so that we can learn how to help these women. I'll also talk to you a little bit about my own work. So I study neurocognitive function in cancer. You may have heard of this as chemo brain. And this is the effect of cancer and its treatment on things like memory or the ability to pay attention. So I'm sharing with you some of our results that we've had from previous research, and this is with respect to a cognitive domain called executive function. So executive function is so important to all of us. It is how we think critically, how we plan, how we make judgments about things. You can imagine how a problem with executive function can have far-reaching effects. We happen to focus on women with breast cancer. And what we have found is that women with breast cancer, as illustrated by this figure, have a big problem with executive function that seems to get worse over time, seems to get worse with therapy. Women report to us that they notice this particularly when they're multitasking. Most of the women in our research continue to work in their occupations through therapy. And they tell us that, at times of high stress, at times when they're trying to multitask, they have great difficulty with cognitive function. Another important finding of our research is that we found that before women even begin therapy, they are having problems with executive function. This line up here illustrates our healthy women who have no cancer. As you can see, they have better executive function before they start treatment and all the way through the first 18 months of therapy. So we've done a great deal of work trying to understand these problems and the mechanisms of these problems. So what do you do about this? Well, we looked to interventions that have helped adults without cancer, so healthy community-dwelling older adults. And what we have found is there's a lot of evidence suggesting that moderate intensity aerobic exercise or physical activity has been found to help improve cognitive function in older adults without cancer. It appears to work through cellular and molecular changes in older adults, by changes in the structure and function in the brains of older adults, and by mitigating other symptoms they experience, such as fatigue, sleep problems, depression, and anxiety. These are all problems, symptoms commonly experienced by older adults and by women with breast cancer. Therefore, we are conducting a study funded by the National Cancer Institute to examine whether moderate intensity aerobic exercise improves cognitive function in postmenopausal women with breast cancer. This is a community-based study. So we have partnered with the YMCA and with Jewish community centers in Southwestern Pennsylvania to deliver this intervention. We have also received funding from the National Cancer Institute, led by Dr. Yvette Conley and my colleague, Dr. Kirk Erickson and myself, to examine the mechanism of these problems and how we think exercise may work. We are harnessing genomic approaches, novel genomic approaches to study these problems. And we should be able to share findings of this in the new year in 2022. Now I'd like to shift gears and talk about the work of some of our other wonderful investigators. Another investigator is Dr. Margaret Rosenzweig, who I mentioned earlier for her leadership position at the Cancer Center. Her research focuses on addressing disparities in cancer survivorship care. In an earlier study, her ACT study, she found that over half of women with breast cancer had a dose reduction, delay, or early therapy cessation, early termination of their cancer therapy. She found that 48% of women these were women with breast cancer, did not receive 85% of their prescribed chemotherapy in the time frame that therapy should have been delivered. And that dose reductions, delays, and early termination were associated with symptom incidence and distress, distrust of healthcare, and belief in chemotherapy. Now, does this matter? Does having these dose reductions and delays matter? Well, her research and the research of others found that indeed it does matter. That patients with treatment modifications experience a shorter time to advanced breast cancer. And that across her entire sample, nearly 40% of Black patients experienced a treatment modification. So as a consequence, she wanted to do a deeper dive into this problem. And she is now conducting her Fenimore study that again is funded by the National Institutes of Health. This research is focused on helping to really understand the basis of these problems, these disparities in the receipt of therapy, so adherence to therapy, and the mechanisms underlying them. She is also studying symptoms and adherence to treatment in patients with advanced lung cancer. Another person who is studying these problems is Dr. Sarah Belcher. Now, Dr. Sarah Belcher is one of our junior faculty. I'm going to be talking about some of our junior faculty now who are conducting groundbreaking research. Dr. Belcher graduated from our PhD program and then went on to Emory University in Atlanta to do postdoctoral training. And we are so pleased that she came back to us after finishing that postdoctoral training. And I'm going to tell you a little bit about her very exciting and important research. So what she found in Atlanta is that African-American patients with multiple myeloma, a very serious type of cancer, experience daily pain despite opioid use. And they also had higher rates of depressive symptoms than normative data. What she wanted to know is, how is this affecting their ability to adhere to the very important oral anti-cancer medications that are prescribed for them? She also found that an important component of the ability of patients to manage their symptoms and adhere to their cancer therapy may be the financial hardship that they experience, as opposed to patients who don't have financial hardship. So based upon this work, Dr. Belcher was successful in receiving a K-23 grant from NIH. Now, this is a training grant in which she will not only conduct research, but receive training from NIH to learn more about this problem and help her continue important research on this in this area. I am honored to be the sponsor or mentor to Dr. Belcher in this important research. I want to tell you that Dr. Belcher wrote this grant and received a perfect score on this grant from NIH. I think that illustrates to you her commitment and talent. We are so pleased that she has come back to the University of Pittsburgh School of Nursing to do her work, her very, very important work, which will look at this problem in patients with multiple myeloma. Another one of our highly successful junior investigators is Dr. Teresa Hagen Thomas. Again, Dr. Thomas graduated from our PhD program and went from here to Harvard University and the Massachusetts General Hospital to do postdoctoral training. She came back to us a few years ago and is conducting groundbreaking research looking at self-advocacy in women with breast cancer. Now, what is self-advocacy? So self-advocacy is an important skill that helps patients with cancer to advocate for themselves, to speak up for themselves in the very complex healthcare system that cancer survivors find themselves in. This is really important because it's associated with quality of life and symptom burden, and it helps women to manage their illness and maintain their self-worth during this arduous journey as a cancer survivor. So she is now conducting work that is focused on an intervention called a self-advocacy serious game that is developed to help women learn how to advocate for themselves in this complex cancer survivorship journey. And I am very proud to say that she recently received an R37 from the National Cancer Institute. And I'm going to tell you why this is so important. An R37 grant is awarded to only a very few investigators nationally. It allows extra time for investigators to launch their intervention research. And it is awarded to only a very few investigators who are viewed to be highly promising researchers. I'm proud to say that Dr. Hagen Thomas received, again, a perfect score from NIH. And I think that both that perfect score and the award of this R37 speaks to the confidence that NIH has in her work. And finally, I'd like to talk about the work of Dr. Marcy Nielsen. So Dr. Nielsen's work focuses on a unique group of cancer survivors. They are survivors with head and neck cancer. She is conducting research in two areas. One of them is in the area of neurocognitive function in these patients. Patients with head and neck cancer have unique problems that influence their neurocognitive function. And she has found that nearly 40% of patients self-report problems with cognitive function. So she is launching research that is focused on describing this problem and understanding the mechanisms as the basis for identifying interventions to mitigate those problems. She also studies radiation fibrosis in patients with this diagnosis. So both head and neck cancer itself, as well as its treatment, particularly the radiation therapy that patients with head and neck cancer receive, result in tissue damage to the face, the neck, and the mouth. And this contributes to symptom burden. They have loss of physical function and decreased quality of life with this radiation fibrosis. So she is focusing research on helping to understand this problem, both from a biological as well as from a phenotypic perspective. In addition, Dr. Nielsen co-leads a survivorship clinic focusing on the needs of head and neck cancer survivors. This is a multidisciplinary clinic The team consists of a head and neck surgeon, a speech language pathologist, and you can see all of the disciplines listed here that are included in this very important and unique survivorship clinic. This, since 2016, has provided survivorship care to 1,500 patients, and 61% of them report at least 3 symptom or treatment effects that impact their quality of life. So this clinic is helping these survivors deal with these symptoms and improve the quality of their lives. I also just want to take a moment to talk about the important work of our members in helping to prepare the next generation of researchers, that is our students. As I mentioned earlier, we work with students from our undergraduate program all the way through our doctoral program, both our DNP students as well as our PhD students. Yehui Zhu is one of our former doctoral students. I had the pleasure of mentoring Yehui Zhu and supporting her through our doctoral program. So with support of the Cancer Survivorship Hub, as well as the endowed chair in cancer survivorship that I mentioned earlier, she was able to focus on her research that looked at the mechanisms underlying musculoskeletal symptoms experienced by women with breast cancer. These women receive a form of endocrine therapy, and this endocrine therapy is associated with a high degree of severe musculoskeletal symptoms. Those symptoms are the main reason, the number one reason why women with breast cancer stop taking this critically important therapy. So you can understand why this research is so important. During her time as a doctoral student in our school, Yehui received funding from the American Cancer Society, the Oncology Nursing Society, and Sigma Theta Tau. She also received funding from the National Cancer Institute in the form of an F99 or KOO. Only one awardee is allowed per institution. So Yehui was selected by the University of Pittsburgh to represent our university in this application. And she was selected among one of only 24 to receive this funding across the United States. She is now doing a postdoctoral training at Harvard University and the Massachusetts General Hospital to learn about imaging techniques to help understand the mechanisms of this problem. So you can see why the support of the Cancer Survivorship Hub is so pivotal to our work, not only in supporting the work of our faculty members, but also in the trainees and students that we mentor. So how has the Cancer Survivorship Hub supported these efforts? It has supported preliminary or pilot research of our faculty members. It has supported us bringing speakers and consultants to the University of Pittsburgh from around the United States to help us in learning about techniques and cutting-edge research for our members, and also in consulting with us in how we can best grow our research. We have also worked with the members of other hubs in the School of Nursing. For example, the Genomics Hub. We work very closely with Dr. Yvette Conley, who leads that hub, and other members of our hub in our own work. Taken together, as a result of this work, we submitted in May of this year a PO1 or a center grant to focus on the foci of our hub, symptoms and adherence to treatment. So we are excited about that application, and we're hopeful that eventually that work will support a center focused on these problems in the University of Pittsburgh School of Nursing. The Cancer Survivorship Hub supports many resources for our faculty and students, not only in our research, but the dissemination through papers, publications, and presentations of our members. Thank you for the opportunity to share with you the work of some of our members. I wasn't able to talk about all of them. That would take too long. But this is my contact information should you ever want to hear more about our work. And with that, I look forward to speaking with you more and to answering your questions.
All right. Sorry, I struggled to stop sharing my screen. So I hope you guys enjoyed my email. So thank you so much, Dr. Bender. It's a lot of really wonderful research happening within the School of Nursing. So there are a few questions if you have time to answer, just a few quick ones. So I know that a wonderful hot topic, as always, is the pandemic of COVID-19. I don't know, you talked a little bit about Dr. Westmiller's work with COVID, but has anyone else experienced any, like stoppage of research within the pandemic, or is that going to be be an aspect of the research that you all will take a look at as it relates to cancer?
Yes. So, we all of us who conduct clinical research had a stoppage of our research for a time during COVID, and this was, probably it was for months. It was quite painful, but during that time, most of us figured out ways to conduct our research in ways that were safe for our participants. So there was quite a laborious process at the University of Pittsburgh to kind of look at the plans that we all developed to reopen our research. And I would say, most of us were able to reopen. And yes, work by many of us in the school and at the Cancer Center is focusing on looking at the impact of COVID on cancer survivorship. Dr. Rosenzweig, I know, has been involved. I mentioned Dr. Westmiller, Dr. Belcher. So several of our cancer survivor faculty are very interested in looking at how COVID has impacted cancer survivorship, treatment and care, and the experience of being a cancer survivor.
Yeah, absolutely. I know that we all know that COVID affects a lot of people who are immunocompromised. So I can imagine that there will be quite an overlap between cancer survivorship and even like COVID survivorship as well.
Absolutely. Yes.
Yeah. So there is a person who's on the call who is a manager of a local Pittsburgh infusion center. And her question is, how can she use the hub to benefit her patients?
So I think that, I certainly think learning about our research and communicating their needs. As you can tell, our research is very clinically based research. And that's because many of our investigators also hold clinical positions. I mentioned Dr. Marcy Nielsen, Dr. Margaret Rosenzweig. So we really have to be engaged clinically and with clinicians so that we stay abreast of changes that are being made in the treatment of patients with cancer, but also the implications of those changes for the experience of cancer survivors. So engaging patients is a very important part of what we do. In fact, many of us, including my work, but the work of others, engage patients on our advisory boards for our research so that they help us to stay in touch with what they're currently experiencing, and they really help us, they help our research because they help us to be kind of grounded in what's important for them. So I would say that there are multiple ways in which patients can be engaged. And of course, we're also available at any time to answer questions, to help in terms of engaging resources that may be helpful to them.
Yeah, absolutely. Absolutely. So towards the end of your presentation, you talked a little bit about one particular student that you have mentored. Are there, like, what are the opportunities within the Cancer Survivorship Hub for current students, whether it's graduate or undergraduate? Do you have like a set number of students that you try to have throughout the semesters or throughout their time at Pitt Nursing, or just what opportunities in general for current students are there?
So one of the things that we initiated in this last year and that we are going to continue to build in the next year is a special interest group for students. And it's primarily going to be, I think, focused on undergraduate students. We met with undergraduate students last year to learn about their interest in cancer survivorship, not just research, but also care, to learn about what they would like to know and hear about. And based on those discussions, we're going to be meeting monthly, starting in the new academic year, so very shortly.
Yeah, right around the corner. Starts on Friday.
Right. and so an important goal of that undergraduate group is going to be to stimulate interest in cancer survivorship nursing. So another way that undergraduate students are engaged is through a program in the School of Nursing called the University Research Mentorship Program. So this allows undergraduate students to actively engage in the research of our faculty. So I think every one of our faculty engages multiple undergraduate students in this way, as well as our doctoral students. And so they get hands-on experience in research. So, and they are also paid for that. This is funding through the school. So this is a wonderful opportunity for undergraduate students to be engaged. In terms of our graduate students, so I don't know that we necessarily have a number in mind. We are mindful of the number of students that each faculty person can mentor. And so we have to be very careful that each faculty person is mentoring doctoral students, but also that they are able to keep that number to a certain level so that they're able to very effectively manage. But we have outstanding students. I think some of them are actually attending today. And I highlighted one of them, but they're all just outstanding students. I mean, it's just an absolute pleasure to work with them.
Yeah, absolutely. All Pitt nursing students are wonderful. And if
They
any are on the
certainly
call, good luck on Friday at the start of the semester. I was down in Oakland like earlier this week, and it's just busting at the seams getting ready. So we're excited to have you guys back on campus. All right, well, there are at least no more questions in the chat, so we will wrap things up. But thank you so much, Dr. Bender, for sharing all of the wonderful research happening within this hub. And for all of you who are attending, thank you so much for taking the time out of your Tuesday to learn more about all of the wonderful research happening within this hub and at the School of Nursing. This session was recorded, so it will be going up shortly on the Pitt Nursing YouTube channel, and I will also be sending it out to all of you and to those who were unable to attend today. Just in case you want to take a look at any of the great charts that Dr. Bender included, or if you have any questions for her, her contact information will be listed. We are also still planning on carrying on with virtual events. I know that the pandemic is slowly wrapping up, but we are still interested in keeping you guys up to date with all of the great things that are happening at Pitt School of Nursing. So keep an eye out for your email for invitations. So thank you, Dr. Bender, once again, and thank you all for attending. Have a wonderful rest of your Tuesday, and hail to Pitt.
Thank you.
Thank you all. Have a wonderful day.